works.
Day number 5.
Especially 30 seconds. Yan.
1,
Ganyan. Tapos kung may tendinitis naman po kayo, yung mga may tendinitis dyan,
4,
dito sa
5,
shoulder, dito sa,
Six.
dito, pagka pinrest niya,
7,
masakit yan. Dito sa area na to.
9,
Yan. All the way
Okay.
dito sa supraspinatus right here. Circular motion nyo lang po yan. Circular motion. Ayan. Gagaling kayo agad nito. Kasi, ito, sikreto po natin ha. Ang sikreto lang ito, just between you and me. Pag ginalaw nyo yung ganito, increase the blood, napaka-effective po nitong technique nito. Huwag nyo ipagkakalat ha. Sa atin lang to. Lalo na doon sa mga sa 100, almost 170,000 followers. Yan, napakasarap. Alam niyo na alleviate yung headaches ko. Kanina may headache ako. Alright, now, pinakita ko sa inyo ngayon kung may paano i-massage yung may tendinitis. Now, kung may bicipital tendinitis tayo, i-massage nyo rin dito. Yan. Circular motion dito sa harap ng shoulder. Yan, sa may biceps. This is the biceps. Itong malaking muscle na to. This is your bicep muscles. So, i-massage nyo in circular motion, medium pressure. Now, igalaw-galaw naman nyo yung shoulder nyo. Kung may tendinitis kayo sa shoulder, galaw-galaw nyo lang po ito. Ganyan. Yan, galaw-galaw nyo lang ha. Habang ginagalaw nyo yung shoulder muscles in circular motion. Alright, galaw nyo external rotation, internal rotation. 30 seconds lang. 30 seconds. Ganyan. Follow nyo lang ako. Ganyan. Excellent. 30 repetitions, 30 seconds in circular motion. Ayan yung mga tendinitis, bursitis dito sa shoulder. Now, pinakita ko sa inyo kung meron kayong frozen shoulder, make sure igalaw nyo, i-move nyo yung kamay nyo dito sa shoulder blade. Etong muscle na to, ito yung scapula, yung may bone dito. Ayan, ilalagay nyo lang yung daliri nyo dito, isara nyo yung shoulder, again, circular motion, and then you can start moving your shoulder like this, just like that. And then if you can go big range, yan, big range po habang ginagalaw nyo yung daliri. Yan. So, very effective, and actually you can use like, you can use again the Dr. Rest liniment cream. Okay, i-massage yun dito. Yan, circular motion like that. Circular motion dito po sa shoulder blade muscles natin. Just like that. Okay. Alright. So napakita ko na may mga tendinitis, may frozen shoulder. Ngayon, ipapakita ko naman sa inyo ang pag-massage. Pagka may headaches naman tayo, pagka may headache, massage natin itong base of the skull. Alright? Ang base of the skull, ay ibig sabihin ang base of the skull nandito sa batok hanggang sa taas ng ulo. Alright? Yan. So ang gagawin nyo, ilagay nyo yung kamay nyo ng ganyan, i-massage lang. Yan. Ang sarap, ipupul nyo ngayon pataas hanggang dito sa scalp area nyo. Yan. Tapos pataas lang po ha. Pataas, gentle to medium pressure. Yan, mga 30 times, mga 30 seconds. Yan, ang sarap niyan. Alright. 30 seconds. Yan, kahit magulo ang buhok. Yan, ganyan. Yan, 30 seconds. Tapos, para ma-alleviate yung pain, kasi minsan yung pain natin, yung stress, yung mga stress sa mga hindi nagtatrabaho or namumroblema kung saan kukuha ng pera, massage lang dito. Yeah. Di baling walang pera, basta healthy, no? Kaya nga ginagawa natin na libre to para makatulong po tayo sa mga pasyenteng may pain. Yan, i-massage naman po itong temporal area. Gamit pa rin yung Dr. Reyes liniment cream or coconut oil. Yan, dito, circular motion, 30 seconds. Okay, and then you can add some rotation just like that on the neck extension, and 30 circular motion just like that, and then move up all the way to the scalp area just like that. Okay, ayan, nagulo na. So yun po yung mga massage technique na pwede niyong gawin, lalo na pagka may headaches, may neck pain. Again, you don't need to spend money. Learn how to do the technique. Ayan, sinashare ko sa inyo yung mga techniques na ginagamit ko. Very effective. It took me 20 years para ma-accumulate ko itong knowledge nito, and I'm just sharing it to you. Libre po sa inyo. Alright? Dahil makakatulong po ito sa atin para mapagaling ang ating mga pain. Now, huwag nating kalimutan. Nakalimutan ko itong now, itong pectoralis muscles, itong chest muscles natin, alright? Ilagay niyo yung Dr. S liniment cream. Napakabango niya. I-massage niyo siya pa, yan pa ganyan. Yan. Below the clavicle. Below the clavicle. Ang gagawin niyo, ipupull niyo siya down all the way to the chest area, just like that. Alam niyo, medyo may pain yan pagka pinapress niyo. Masakit ng konti. Pero pagkatapos nyo itong session na to, you're gonna feel a lot better. O yan, press down all the way to your sternum. This is your bone, yung sa gitna. And then your clavicle, ito yung mahabang bone dito, okay? Sa below your neck. Alright, just do this massage all the way to the chest muscles. Pwede nyo rin igalaw dito sa may chest muscles natin. Dito yan, yung pectoralis muscles. Igalaw-galaw nyo lang po ito. Very effective. Yan. Galaw-galaw mga 30 seconds again. Ganyan po. Or you can glide yung fingers going to the pectoralis muscles. Again, you can do, after the massage, you can do some stretching, the W, the V, the T. So you can do that just like this. Alright. Yan po yung massage, salt massage, para sa mga shoulder pain, neck pain, headaches. Yan po ang kumpletong.
Hi, I'm Dr. Brian Paris, and I have an important question for anyone with arthritis. Which
5, 6, 7, 8, 9, 2.
Hi, my name is Dr. Andrea Furlan. I am a physiatrist and pain specialist in Toronto, Canada. If you have been diagnosed with hip or knee osteoarthritis, your doctor probably told you to go and do some exercises. Today, I'll show to you the exercise that I recommend to my patients with hip and knee OA or osteoarthritis. The type of exercises for OA are lubrication, aerobics, weight bearing, and stretching, which can be remembered as LAWS. I'll show to you 20 LAWS exercises today. So let's go. First, it's important that you understand why the LAWS exercises are important. When people understand why they're doing the exercises, they adhere to the exercises and feel motivated to keep doing them regularly. Lubrication is important because the joint produces a liquid called synovial fluid. This fluid is produced when we move the joint or we put weight on it. The synovial fluid provides nutrition to the cartilage. The cartilage is a thin layer that covers the bones to form a slippery surface. So the bones will absorb the shock and will move smoothly by reducing friction. Lubrication is important, especially in the morning. Many of my patients have morning stiffness. This is because at night they don't move the joints, and then there's not a lot of production of synovial fluid. So the fluid tends to thicken. This is what causes stiff and creaky joints.
1, 2,
Look at this crystallized honey. Imagine that the synovial fluid is like this. If we warm it a little bit and mix with a spoon, the honey will become liquid and smooth again. Also, the more we move the joint and put weight on it, it's like producing more honey. So remember, motion is lotion.
6, 7.
So, I recommend you to do the lubrication exercises in the morning before you get out of bed. This will help to warm up the joint, to improve the range of motion, to break down any thickness of the synovial fluid. The other exercise, aerobics, weight bearing, and stretching, you can do during the day. Aerobic exercises are important to maintain a good cardiovascular system. Aerobic exercise are any type of exercise that increase the heart rate and respiratory rate. This may include walking briskly, dancing, biking, swimming. Make sure you talk to your doctor to ensure that you don't have any restriction for this activity, like aerobic exercises. Weight-bearing exercises are extremely important for people with OA. The main advantages of weight-bearing exercises is that they reduce pain in the joint, and they also help to maintain the calcium in the bones, especially important for people who also have osteoporosis. It is very common that people will have these two conditions, OA and OP, osteoarthritis and osteoporosis. You may want to watch another video that I made about osteoporosis. The S in LAWS is stretching. Stretching is important to maintain flexibility, to maintain a good range of motion in the joints that have osteoarthritis. When people have joint pain, they tend to protect the joints and use it less and less. Then the muscles get shortened and stiff. The tendons, the ligaments, and the joint capsule will all get very tight. So it is important to do gentle stretching of the structures around the joints. At the end of this video, I will explain some movements that should not be done if you had a recent hip replacement or arthroplasty, because some exercises will put the hip at risk of dislocation. So let's get started. I'll show you 20 exercises today that are good for hip and knee osteoarthritis. Before you do these exercises, you may want to apply some heat, like a bag of beans that you can warm up in the microwave. You can put this 2 minutes in the microwave, and then you leave here for about 2 minutes to warm up the joints. You can still do those exercises. So the exercise number 1 is for the knee. It's flexion and extension for the knee. So you will be doing extension and flexion. That's the only movement that the knees can make. Extension and flexion. So we'll be doing this, bend both knees and do one at a time. So you'll be doing 8 repetitions for each knee. If this is too easy, you can do 12, 15 or 20 repetitions. Do for the other knee. And this is good that you're doing the bench because you are doing against gravity, which also helps to strengthen the quadriceps. And if you stretch all the way up and straight your knee, you'll also be stretching the hamstrings and gastrocnemius muscles here in the back of your leg and thigh. So these are the same time, same stretch, strengthening, but it's most importantly lubrication exercise for the knee. So do this. That's the exercise number 1. The exercise number 2 is lubrication for the hips. We're going to draw numbers in the air. So bend the left leg and you're going to draw number 1 in the air and draw very big. Number 2, number 3. This is movement for the hips. Number 4, number 5, number 6, number 7, number 8, number 9, and that's it for the right leg. Now bend the right and do the numbers with the left leg. Number 1, number 2, very big. The bigger you do, the better. Number 3, number 4, you are lubricating the hips. Number 5, number 6, 7, 8, and 9. Okay, so that's lubrication for the hips. Now, the exercise number 3 is a movement that the hips do is external rotation, internal rotation. So we'll be doing external rotation, internal rotation. External rotation, internal rotation for the hips. Do this 8 times, or 12, or 15, or 20. The more you do, the better. So you're moving your hips in and out. This helps to expand the capsule. It helps to warm up the liquid inside of the hip joints. And the more liquid you produce with the hip joints, the more nutrition to the cartilage. So this is great for your hips. So the next exercise is hip abduction. It's for the hips to move open, up and down. So it's important that you keep your toes pointing forward and pointing down. So you can do this 8 times for each hip. I'm doing this for the left one. And when you do this 8 times, you're going to do now the lower leg. We're going to work on the inner thigh muscles here. This is called adduction for the right leg. We're going to put this leg on the front one, and we're going to move up this one 8 times. This is adduction. Keep your knee straight. Keep the ankle straight like that. And move the lower leg. You're going to do this. And this is hip abduction for the right one. So if this exercise is too difficult for you, you can do a modified version, which is the clamshell. Just keeping your body straight, but now you're opening and closing like this. It has about the same effect. You're strengthening these muscles, you are lubricating the hip by moving. Just try not to go backwards, just stay upright like this, and open and close your hips. This is the clamshell. So now this exercise is extension of the hips. You're going to be on your stomach and raise the left leg 8 times.
1, 2, 3, 4, 5, 6, 7, 8, 9.
And you're going to do for the right leg 8 times. And you can do 12, 15, 20.
1, 2, 3, 4, 5, 6, 7, 8.
And then the last exercise that you do before you get up is the same thing that we did for the other side, but now we're going to do a abduction for the right leg. Keep the knees straight, the toes pointing forward and pointing down. And you do this 8 times for the right leg. You can do 12, 15, or 20 if you want. And the other one is abduction for the left leg. So that's 8 times. You should not be doing abduction exercises if you just had recently a hip replacement, a joint or trophosty in your hip. So this exercise is not indicated because you can dislocate the hip. If you had a hip surgery in the last 3 or 6 months, you should talk to the surgeon of what kind of exercise you can do. So those are the exercises that you should be doing in the morning to warm up your joints, hips and knees, to reduce the stiffness before you get up in the morning. The next exercises are weight-bearing exercises. You may want to do them during your day. Try to incorporate them as routine when you are cooking or watching TV. For these exercises, you will need some equipment. You need the following. You need a wall that you can slide on, stairs or steps, a mat, a sturdy chair, like this one here, without wheels, so it doesn't slide on, and ankle weights, like these ones. They have 1.1 kilogram, and you can attach them around your ankles to increase the weight. So this exercise is squatting on the wall. So we're going to squat against this wall. You can keep your feet apart and approximately 1 foot distant from the wall. Now touch the wall with your head, your shoulders, and your hips. And then you're going to start going down, 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 down. Stay there for 5 seconds. 1, 2, 3, 4, 5. Then come up. And you can do this a couple of repetitions. And you can also increase the time that you stay in that position. You can increase to 10 seconds, 20, and 30 seconds. The more you stay in that position and the more you can repeat this exercise, the better. So you can do this many times during the day. Anytime you find a wall in your house or a door, you can do this exercise and stay there. That's excellent to strengthen the muscles around your hip. And this is weight bearing because we're putting the weight of your body on the joints of the hips and knees. So for these exercises, if you have ankle weights, you can attach them to your ankles to increase the weights. So then you will be doing these exercises more efficiently. These weights, they have 1.1 kilograms. So for these exercises, we're going to do abduction of the hips with weight bearing when you are standing up. You need a chair that is a sturdy chair that doesn't have wheels, so you're not going to sleep. Or it could be the countertop, so something for you to hold on. Your body straight, your knees straight, the toes pointing forward, and then you're going to do opening and closing. Knees straight, toes pointing forward. Do this 8 repetitions with the left leg. If this is easy, you can do 12 or 15 or 20 repetitions. So after you do this, then you repeat with the other leg. Just do the same thing. Body upright. Don't bend like this or this. Just stay upright, holding on something here, and just open. Knees straight and toes pointing forward. So for this next exercise, you also need a chair here. We are going for the hip extensors, the gluteus maximus muscles. Let's start with the left leg. You just go like this, keep your body straight, and 20 repetitions. And then do with the other leg. It's important that you keep your trunk upright and your knee straight. You're doing this for the hip. So feel the hips moving. Feel the hips, the tension in the capsule. You're distending the capsule. You're moving the hips in this position. So for these exercises, we're going to do, for the knee exercises, we're going to do weight bearing for the knees. We're going to do knee flexion, extension. So again, hold to the chair, and with the upright trunk, just bend the knee backwards and try to touch the knee as farther than you can. And at the end, if you can even do some stretch here, that would be good, because it will be stretching the quadriceps, these muscles here at the front. But if not, just try to go up as far as you can. Do this 8 repetitions, and when this becomes easy, you increase to 12, 15, 20. Repeat with the other leg. You're doing this for the knee. You are flexing and extending the knee. Extend completely, flex completely, and if possible, pull a little bit here to stretch the muscles. So this is movement for the knees. Do 8 repetitions, or 12, or 15, or 20 repetitions. So you can do this in a countertop, in your home, anything that you have, or a sturdy chair like this. So for this exercise now, we're going to do sit and stand. So get the chair that we were doing the exercise before, and you're going to do a stand and sitting. Try to sit at the edge of the chair, and if you can, just touch the chair and stand completely. Touch the chair and stand. Touch the chair and stand. This is exercise for the quadriceps, for the hamstrings. And when you go down, when you are sitting, try to do very slowly because then you're strengthening the hamstrings here. And then if this is too hard for you, you can do a complete seat and then four. A complete seat and then four. So this exercise is for the knees. The muscles that we have inside of the knees here are called vastus medialis obliquus. The quadriceps have four heads. The vastus medialis is the head more medially, internally here. In people who have osteoarthritis of the knees, this part of the quadriceps is usually weak. So we have to strengthen this. And how do we do this? So with the ankle weights that we just put on our ankle, we're going to do straightening of the knee, and then you just do flexion of the knee, flexion extension at this position here. So you can come close to the back of the chair, just straighten your knee, just lower about 30 degrees, lower and up, down, up. Do this many repetitions with ankle weights. So you're strengthening the vastus medialis obliquus here, this muscle, which is very important to stabilize the knee. And then do for the other leg, here, 30 degrees. So do 8 repetitions. When 8 is too easy, increase to 12, 15, and 20 repetitions. So this exercise we're going to do in the stairs. If you don't have stairs, you can use the steps. Make sure that you have railings so that you don't lose your balance. We are going to do right foot up, right foot down. Right foot up, right foot down. We're going to do this for 1 minute, or you can do this 20 more. And when you breathe out and relax, you can stretch. Put a little bit of force here to force them to go down. If you can't do this, if your knees are here, that's fine. Stay here. But if you can, relax and go down. Yes. And you can do some movements like butterfly. It helps to relax the adductor muscles and stretch them. So these next muscles that we are going to stretch are the hamstrings, the muscles that are behind our thigh, and they bend the knee, and they also move the hip. So to stretch the hamstring muscles, there are many different techniques. I'm going to show you one that I do on the floor. So for me, it's easier if I bend one leg, and now I'm going to stretch the right leg. So what I do is keep the big toe pointing towards your nose, and you are going to try to touch your big toe. So the lower you go, the better. You see that I'm very tight because I spent the whole day sitting. So the more you are sitting during the day, the tighter are these muscles, and the more you need to stretch. So then you touch the toe of that leg and try to lower your head, if possible, touching your head to the knee. I can't do that, but that's because I need to stretch more. And then you can relax your head and pull, 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 and then pull, and pull here, let go, and do this for the other side. Let go and pull. And you feel all the muscles in front of your thigh stretching, stretching. I prepared a document with a summary of all these 20 exercises. Go to the description of this video below and you will find the link to the document to download. If you had a recent hip replacement, your doctor may have told you to take some hip precautions. These are certain movements that may cause the new hip to displace or dislocate. These movements are the following: crossing the legs, bending your hips above 90 degrees, so this is 90 degrees, so not bending more than this, and also twisting around the hips, so doing these movements or twisting. Please remember that this video is for educational purposes only. If you have been diagnosed with osteoarthritis of the hip or knee, please ask your doctor or physiotherapist if these exercises are appropriate for you. If you like this video, don't forget to like it, subscribe to this channel, and to turn on the notifications. I also tweet, I have a Facebook page and an Instagram account. You may contact me
As
there.
with other forms of osteoarthritis, OA of the hip or knee is a progressive disease of the whole joint that leads to breakdown of joint cartilage and the underlying bone, and has a detrimental effect on the joint lining, surrounding ligaments and muscles. OA occurs when the body is unable to keep pace with repair of deteriorating cartilage tissue. Cartilage is a firm, slippery, compressible material that covers the ends where two bones meet to form a joint. It reduces friction between bones. Osteoarthritis of the hip initially, because the pain can occur in other locations such as the buttock, groin, thigh, or knee. With knee arthritis, where you feel pain in the joint may vary and can even extend to the front of your leg. Your experience that targets the specific muscle groups and areas affected by OA can help reduce pain and disability. A program for hip and knee OA should include aerobic or cardiovascular exercise, muscle strength, neuromuscular strength. When you're starting a new exercise routine, or looking to increase your physical activity to help address osteoarthritis symptoms or improve your physical fitness. If you're new to exercise, it's important to first speak with a healthcare professional to make sure that you're fit to start a program. Other types of exercise. A warm-up is necessary to get blood flowing to your heart and muscles to prepare your body for a workout. If you have seen the Introduction to Osteoarthritis and Exercise video on the Arthritis Society's website, you'll recall that there are 4 main types of exercise. Cardiovascular exercise, also known as endurance or aerobic activity or exercise, works your heart and lungs, increasing your breathing and heart rate. For strength exercises, the goal is to make your muscles stronger, to help stabilize your joint and improve your mobility. Neuromuscular exercises involve focusing attention on proper lower extremity alignment position and joint control, reducing the load on your joints and allowing you to move with greater ease. This is also important to help with balance, reducing your risk of falls. Finally, flexibility exercises increase your joint mobility and stretch your muscles, helping you stay supple and limber. After you've warmed up, when you're starting any strength or neuromuscular exercises, it's important to focus on good alignment to reduce the load on the joints and surrounding soft tissues. With any knee bending and straightening activities, make sure your knee stays in line with the second toe of your foot. Don't let your knee collapse inwards. Be aware of proper knee alignment during all activities, even when biking and in your everyday activities such as going up and down stairs, exercising in a standing position, or while walking. With any activity or exercise, you will want to keep your lower back in a neutral posture, the strongest position that minimizes joint load. Neutral posture is keeping the normal arch of your low back without flattening it, tilting your pelvis, or exaggerating the arch. To further support your spine during the activity, tighten your core muscles, the muscles around your trunk, which include your abdomen, low back, and buttocks. This will support your spine so that there is no back movement while moving your legs. To practice this, think about what you would do to prepare yourself for someone about to poke you in the stomach. You would immediately tense and stiffen your core core muscles to brace for this impact. This is exactly what bracing is and what we mean by tightening your core in the exercises that follow. From our introduction video, you'll remember the FIT principles: frequency, intensity, time, and type. For strength and neuromuscular exercises, aim for a frequency of 3 times per week on alternate days, and make sure to use proper alignment in your everyday activities. Once you've achieved your goal muscle strength, you can reduce strengthening exercises to 2 days per week to maintain your gains. The intensity and time of your exercise will change as you get stronger. To achieve further benefits, you will need to progress your activity once it starts to become easy. Start with 6 to 8 repetitions of each exercise. This is called one set. If you do more than one set of each exercise, it's generally easier and takes less time to perform one set of every exercise first, also known as a circuit, before doing a second set or a second circuit. You may start your program with 1 or 2 sets or circuits of exercise if your muscles are weak, and after a few weeks, try for 3 sets. Once you are doing 2 or 3 sets, you can increase the number of repetitions. An example of a gradual progression could be to add 1 repetition to each set each following week, so that your body has a chance to adapt. Your body needs time to adapt, but if you don't gradually, you start once again at 3 sets of 6 to 8 repetitions. Gradually increase the load by adding 1 repetition to each set every week until you reach 3 sets of 15 repetitions. If you have limited time for a workout, make sure to target the muscle groups you know are weak. For most people, this includes the hip abductors, hip extensors, and quadriceps. If you have hip osteoarthritis, consider adding hip flexor strengthening in addition to hip abductor, hip extensor, and quadriceps strengthening exercises. If you have knee osteoarthritis, consider adding hamstring and calf muscle strengthening to hip abductor, hip extensor, and quadriceps strength exercises. For low back pain, you would benefit by adding front, side, and back trunk strengthening exercises. Each of the exercises we discuss has 2 or more levels of progression. Once you can do 3 sets of 15 repetitions, you're ready to move on to the next level. You may progress faster with some muscle groups than others. It's okay to be at different levels of difficulty for different muscle groups. It's important to include neuromuscular exercises that focus on your trunk and leg alignment. As you may remember from our introduction to osteoarthritis and exercise video, neuromuscular exercise or activity focuses on attention to and awareness of body position and how you move, improving your quality of joint movement, reducing the load on your joints, and allowing you to move with more ease. We've included some neuromuscular exercises in this series to give you an opportunity to practice. This exercise is one way for you to strengthen your hip abductors if it's difficult for you to lie on your side. For example, if your shoulder is painful. On a bed or floor mat, lie on your back with your knees bent and your feet flat against the surface. Use a resistance band tied snugly in a loop around your knees or just above them on your thighs. Tighten your core muscles, the muscles around your trunk of your body, to keep a slight arch in your low back so it is not flat against the bed, but doesn't arch up as you work your hips. Your back should not move. Tighten the resistance band by moving the knees away from each other, then return to the start position with control. And lie on your right side with your hip hips bent to 45 degrees and your knees bent to 90 degrees. Position a tied, lighter resistance band snugly around your thighs just above your knee level. If pressure between your knees is bothersome, place a pillow between your knees. Keep your pelvis vertical or at a 90-degree angle to the surface you're lying on, or even slightly rolled forward. Keep your feet together as you raise the top knee away from the bottom, while keeping your core muscles firm to support your back. Stop raising the knee when your body or pelvis begins to roll back. Lower your knee back down with control. Repeat on your left side. When performing this activity, remember that the key is quality of the movement. Bigger is not better. Placing a hand on your hip may help you notice if you're rolling back. If you are, try pushing your feet into a firm surface like a wall to control pelvic motion. To progress this activity, or if you can do 3 sets of 15 repetitions without being tired, use a medium resistance band. Progress to heavier or stronger bands as you're able.
1, 2, 3, 4, 5, 6,
Stand in front of a counter so that your hands can provide support if needed. If you have a mirror over your bathroom counter, this is ideal to provide you with feedback about your body position. Place a resistance band tied snugly around both legs, just above the knee level. With your core muscles tightened, slide one leg out to the side, keeping your foot on the ground, your pelvis level and trunk upright. If you're on a wood floor or a tile floor, you can put a face cloth under your shoe to help your foot slide better. Or if you're on a position in a controlled this exercise, use a resistance band tied snugly just above knee level. Don't let your knee collapse in as you perform this exercise. Instead, push out against the band while ensuring hands on the seat or armrests if available. Sit in an upright chair with your hips and knees bent to 90 degrees, keeping your core muscles firm and maintaining the natural arch in your low back. Raise one thigh slightly off the seat. Place your opposite hand on your thigh just above the knee and press your thigh up into your hand for a count. Sit on a chair or a flat surface. Bend your knees to 90 degrees and loop a towel or untied resistance band around your foot. Sitting upright, straighten your knee against resistance of the band. You should feel a tight size. Be careful to avoid slouching your back. Keep your core muscles firm. Sit upright and maintain consistent speed and resistance throughout the range of motion of the exercise. Don't reduce tension or control as you return your leg to the start position. Position a firm kitchen or dining room chair 2 foot lengths away from the edge of support. Place your right foot up on the step. Tighten your core muscles and slightly lean forward at the waist, raising your left foot up by straightening your knee and trunk. Pause. Lower your left foot back down to the ground slowly. When raising and lowering or bending and straightening, make sure that your knee remains over your second toe. Check that your pelvis remains level, especially when lowering back to the start position. Repeat on the other side. If it's difficult to maintain a good position, start stepping up on a large phone book or other firm surface that's about half the height of a step. To increase difficulty, use less hand support. We still suggest, however, everyone use a handrail while doing regular stairs as a risk management strategy to limit falls. Avoid tipping your pelvis or leaning your trunk to one side to step up and down to compensate for weak muscles, and be careful not to collapse in at the knee of your supporting leg. Lower down by bending the hip and knee of the supporting leg rather than reaching with the descending leg, and keep your knees pointed over your second toe. Sitting in a firm chair, straighten your right leg until the knee is 45 degrees from fully straight, keeping your heel on the floor. Push your heel into the floor for a count of 3. Repeat on the other side. To progress to resistance through range, sit on the edge of a chair, bending your left knee to at least 90 degrees so that the foot of your supporting leg is flat on the floor. Straighten the knee of your right leg, keeping only your heel in contact with the floor. Press your right heel into the floor while bending your right knee. While standing in front of a table or counter with your hands supported, place the loop of a resistance band under your right foot so you're standing on it and the other side of the loop around your left ankle. Keep your core muscles tightened and your pelvis level. Raise your left heel towards your buttocks, bending at the knee. Your right leg should remain straight and your left knee should remain pointing towards the ground. Slowly lower your foot to the starting position in a controlled manner. Repeat on the other side. If you experience a muscle cramp, especially at the back of your thigh, don't bend as far or instead use an easier resistance band. Sit on a chair or flat surface such as the edge of a bed with a towel or untied resistance band looped around the ball of your right foot. Pull the band or towel, flexing your foot towards you. Press your foot against the towel or band, pushing it away from you. Maintaining resistance, return your foot to the start position in a controlled manner. Repeat on the other side. Standing in front of a counter for support, tighten your core muscles and slowly raise both heels off the ground as far as possible so you're standing on the balls of your feet. Pause at the top and slowly lower back down. Take care not to roll over to the inside or outside of your foot by keeping your weight evenly distributed between your big toe and little toe. To practice your balance, lessen your hand support on the countertop. To further increase the level of difficulty, perform this exercise